What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we're covering best ways to deal with patients with prosthesis as far as technique goes on your x-ray equipment. So to give you context, I'm a night shift tech. I do 7 on, 7 off, and also dabble in day shift. So these beautiful people, these cyborg / Terminator people, as we call them, with the prosthesis, usually people who break their bones or elderly patients are notorious for having them hip replacement. The most common ones are the hips, shoulders, and some ankles and some spine. So usually those are the common spots you'll find some hardware. So what tends to happen, and it's mainly what I've seen, is the knee. The knees are the very tricky, and sometimes spine. So with knees, because they're so dense, and most older patients, their bone is so frail and old. Usually if it's an elderly patient, a normal elderly patient, normal bones, usually you have to drop your technique really low. So when they expose it doesn't burn them out. But if you shoot a low exposure onto someone with prosthesis on their knees, essentially that metal will absorb it all, and then your whole image will be underexposed. So there's two ways around it. I've noticed you could either shoot it hot on one, and the prosthesis will show up good, but the bone will be burned out, burned out, and then you can kind of put a grid on it sometimes, and that will fix it. Other times you shoot it with a grid, and you shoot it a little bit more hotter, and that will kind of have it's still gonna look bad because there's a prosthesis, but it's better than shooting it normal with low technique. Sometimes I kind of do both, and I copy it, and I'll put one with a filter, one without a filter. Sometimes you have to run it under a random thing after post-processing. Sometimes you have to run a T-spine under for the knee to get better, you can see better the bone and stuff like that. If you're doing it inside of the room where you, let's say, T-spine, sometimes patients have that. If you use fixed techniques, those could help you. Or if you run, let's say it's an L-spine, you run it under a T-spine. Sometimes different little quirks like that will help, get you better images. If they're younger patients that have better, their bone isn't as, deossified, they have more bone marrow, it'll be easier even if they have prosthesis. Hips are pretty easy because it's thicker, more bone, so it's more easier to shoot it hot and it won't get burned out. Shoulders is another iffy one too, that occasionally it does get burned out, especially for older patients. Yeah, it's been your boy Miguel. See you on the next one.